Welcome to Seattle Humane's Euthanasia Decisions Training Webinar. This presentation is designed to help better understanding of this difficult and emotional topic, as well as to help staff and volunteers discuss our policies on euthanasia in an informed manner. Throughout this webinar, you will learn the definition of the term, the reasons for euthanasia, and the policies and procedures in place regarding euthanasia. We will also discuss how you can help Seattle Humane with animals at risk of euthanasia. We'll begin by going over some common words and phrases and defining what they mean within Seattle Humane. Euthanasia is a procedure that ends a pet's life by using a drug that stops the animal's heart within seconds of being administered. Animals are made as comfortable as possible and are given a sedative beforehand to reduce stress and discomfort. At Seattle Humane, euthanasia is performed by a licensed veterinarian and a certified euthanasia technician. This procedure is closed to volunteers and staff unless their presence is necessary for the euthanasia, as we strive to provide a calm and low-stress environment, and additional individuals in the room can be counterproductive to those goals. Respect and compassion for the animal is held throughout the procedure. Seattle Humane works hard to reduce shelter stress for all animals, but it's important to remember that all shelters are stressful by default. Shelter stress is distress, or extreme negative stress, caused directly by the shelter environment. Stress can show itself in different ways, but some common signs include panting, pacing, refusing to eat, hiding, dilated pupils, barking, inability to settle, or pretending to sleep. Additionally, animals can experience this stress both acutely and chronically. Immediately upon entering the shelter, most animals experience acute stress. They are in an unfamiliar environment, filled with strangers, artificial lights, and strange sounds and smells. Animals also experience acute stress during or after a negative experience. Chronic stress is long-term, and most animals will show some signs of chronic stress by their second week in a shelter stay. Numerous studies in both humans and animals demonstrate the long-term negative effects of both acute and chronic stress. And for animals, chronic stress can dramatically and permanently alter their behavior, with effects seen even after they leave the stressful environment. Stress can be caused by other factors, in addition to shelter stress. If an animal's stress advances to a stage where the undesired behaviors, for example, fear that's causing the animal to act aggressively, are unsafe to other animals and people, or that the animal's stress has reached a point where they no longer have a good quality of life, then unless we are able to quickly find another option, we may be left with euthanasia as the only humane option. In later slides, we'll discuss how we monitor and reduce stress. Live release rate. This is defined across the animal welfare industry as the percentage of animals that enter a shelter who are either transferred to rescues or other shelters, returned to owners, or adopted. Currently, Seattle Humane has a 98% live release rate, meaning that only 2% of our total population is euthanized. Of this 2%, most euthanasias are either due to end-of-life medical concerns or fading kitten syndrome. Fading kitten syndrome is the term used when a kitten has a set of specific life-threatening symptoms which cause the kitten's health to quickly decline. Only a small subset of that already small percentage are euthanasias due to animal behavior. No-kill is an industry-wide term. It does not mean that euthanasia is never an outcome. Rather, it means that the shelter has a live release rate of 90% or higher. Currently, Seattle Humane has a live release rate of more than 98%, compared to the national average of 68%. For Seattle Humane, no-kill means we do not euthanize a pet for space. meaning euthanizing an animal already in our care so that space can be given to a different animal. And we do not euthanize for length of stay, meaning euthanizing an animal because it has been in our care past a certain length of time. However, it is important to note that we do euthanize if an animal's quality of life is extremely poor, and quality of life can correlate with length of stay, as a longer time in the shelter can result in more stress. As long as the animal has good quality of life and is safe to handle, he or she faces no time limits in our care. We consider euthanasia only as a last resort when we are out of options to alleviate physical or mental suffering. An animal would be considered for euthanasia if they have a medical condition that cannot be managed to alleviate pain or discomfort. We would consider euthanasia for animals experience profound shelter stress that cannot be adequately managed through on-campus interventions or off-site foster homes. We would also consider euthanasia for animals for whom there is no suitable transfer option or for whom an appropriate adoptive home cannot be found. Often in those cases, these animals pose a significant risk to the public, other animals, or themselves. Animals are considered a risk when they have a significant bite history and when it is difficult or impossible to safely manage the animal to prevent future instances of aggression. When an animal experiences a significant level of anxiety that leads to self-harm that cannot be mitigated even outside of the shelter environment, finding a foster or adoptive home or transfer option may not be possible. Now that you know what euthanasia is and Seattle Humane's policies surrounding euthanasia decisions, we'll talk about how we manage our population to prevent euthanasias whenever possible. At the core of any euthanasia decision is Seattle Humane's belief that animals have specific rights and that we must provide accommodations to meet them. These are also called the 5 freedoms, and they drive our decisions for housing, general care, and euthanasia. Providing appropriate, species-specific spaces is imperative to keeping our pets healthy and happy, as well as getting them adopted. Additionally, these freedoms help prevent shelter stress, which correlates with lengths of stay, rates of illness, and euthanasia outcomes. The 5 freedoms, as outlined and endorsed by organizations such as the ASPCA, the World Organization for Animal Health, and the Association of Shelter Veterinarians, are as follows. We provide freedom from hunger and thirst by providing ready access to fresh water and a diet that maintains health and vigor. If an animal does not eat, we provide prompt medical and behavioral intervention. We provide freedom from discomfort by giving the animal an appropriate environment, including protection from the elements and a comfortable resting area. We provide freedom from pain, injury, or disease through prevention or rapid diagnosis and treatment. Euthanasia may be warranted if an animal is experiencing pain or suffering that cannot be appropriately managed. We provide freedom to express normal behavior. We give the animal sufficient space, proper facilities, and company of the animal's own kind when appropriate. We also provide a species-specific environment and individual-specific plan. We provide enrichment for all animals through treats, toys, and interesting sounds, smells, and experiences. For dogs, we also provide walks and playgroups when appropriate for that dog. We provide medical and behavioral intervention if an animal is exhibiting abnormal behaviors. If an animal does exhibit abnormal behaviors caused by illness or a high degree of stress which cannot be appropriately managed, euthanasia may be warranted. We provide freedom from fear and distress by ensuring that the animal is housed and cared for in a way that avoids mental suffering. Euthanasia may be warranted if an animal is experiencing a high degree of distress or fear that cannot be appropriately managed. Each morning, staff members from veterinary services, animal care, and other ops teams attend daily rounds. During this time, we consider whether the animal is experiencing kennel stress. In particular, we consider the following questions. Are they eating, drinking, urinating, and defecating normally? Are they exhibiting any behaviors indicative of high stress, such as pacing, inability to settle, pretending to sleep, spinning, lunging, or biting? What does their kennel presence look like? We then ask, is this animal experiencing a medical concern? Next we ask, what is keeping this animal from being available for adoption or from being adopted? What interventions are needed, if any? Finally, we ask, is this animal improving, declining, or remaining the same medically and behaviorally? Action items to address concerns raised about each pet are communicated to the appropriate program after rounds. In addition to daily rounds, a member of each operations team, which includes intakes, animal care, adoptions, foster, behavior, and veterinary services, attends a weekly population meeting to discuss each individual pet in our care. Specifically, we discuss which outcome options are desired and ideal for that individual animal and the best steps forward on the path towards those outcomes. Adoption is the primary outcome for most of our pets. We will discuss euthanasia only if the animal is experiencing severe medical conditions, very poor quality of life, or if there are safety concerns. Additional meetings are held to allow deep discussion of special cases and fully consider each outcome option. The weekly population notes are uploaded into PetPoint and can be found in a memo titled Population Meeting on each individual animal's profile. We will consider transfer options for animals at risk of euthanasia only if the receiving organization has resources or an adoption pool that we do not, and if Seattle Humane staff feel the animal would be better served in a different environment. Transfers can only happen if the receiving organization is willing to accept the animal. Many rescue groups will not accept animals with significant behavior or medical challenges. Additionally, reputable rescue groups are often full. Generally, Seattle Humane prefers not to send animals to sanctuaries, as we believe animals in those environments are at great risk of developing kennel stress or of living in social isolation. However, we will consider this option if the animal is social to both people and other animals, and an adoption outcome is not possible. We will now focus on the steps that occur when an animal has been identified as at risk for euthanasia or when a decision to move forward with euthanasia has been made. When we determine that an animal is safe to be available for adoption, or that with behavioral intervention this may be possible to achieve, but is still demonstrating behaviors that qualify them as at risk for euthanasia, we will send an email to all staff and volunteers who want this type of communication. The purpose of this communication is to get actionable ideas for placement so that euthanasia can be avoided. We will also email the same group once euthanasia, transfer, or adoption of that pet has occurred. There are some behaviors that Seattle Humane is unable to allow in animals available for adoption, as the behaviors pose too high a risk to the public or to the animal itself due to self-harming behaviors. In these cases, an at-risk email may not be sent. If you would like to be notified when an animal is at risk or has been euthanized, you may choose to opt in to our mailing lists by emailing volunteers@seattlehumane.org. You must agree to abide by the terms and conditions, including the following: keeping the information private and confidential, recognizing that not all of our staff and volunteers have chosen to receive this information. Contributing actionable ideas, not criticisms. Trusting in staff and leadership, and assuming the best of our organization. Accepting that while staff is doing everything possible, they do face limitations. Understanding that a lot of attention and upset people saying goodbye to a pet may cause that animal distress, and agreeing to work to minimize stress and anxiety for the pet. If an animal is experiencing immediate and acute medical distress that cannot be medically managed, staff veterinarians will euthanize the animal without first going through the at-risk process. In all other cases, the euthanasia conversations will begin only after all other options have been exhausted, and an at-risk email may be sent at that time. Seattle Humane has a 3-signature approval process, meaning that 3 different people need to agree and sign off on the procedure before it is completed. The only exception to the 3-signature procedure is for animals who are suffering from an acute medical condition that cannot be treated. If all 3 parties sign off, the euthanasia will be performed within 24 hours and as soon as possible, as we do not want to continue housing the animal in a stressful environment any longer than absolutely necessary. Once the euthanasia has been completed, an email will be sent to the opt-in group. Respect and compassion for the animal are held paramount throughout the medical procedure of euthanasia. The procedure is performed by a veterinarian and a certified euthanasia by injection staff member. The procedure is closed to most staff and volunteers, with some exceptions, to help provide a calm and low-stress environment. Animals are pre-medicated to reduce stress and then given an IV drug that leads to cardiac arrest. If an animal is euthanized for a medical reason, foster parents may sometimes elect to be part of the euthanasia process, at the discretion of the veterinarian performing the procedure. Foster parents are never required to be present. The euthanasia process is not open to staff members or volunteers unless they are required for the procedure. Foster parents and staff can elect to pay for animal cremains. Pregnant spays are when veterinarians spay a pregnant animal, and in the process of the spay procedure, they remove the fetuses. The reasons for this decision are many. We often encounter pregnant animals who have not had previous medical care, may have been exposed to infectious diseases while housed elsewhere or as a stray, and have likely been highly stressed throughout their pregnancy due to their environment. In many cases, kittens or puppies born under these circumstances pass away because of these factors, which further causes distress to the nursing mom, volunteers, and staff at Seattle Humane. Additionally, there are many living neonatal animals that are at risk of euthanasia, so Seattle Humane must balance the needs of the currently born with those of pregnant animals. For all these reasons, in most cases, Seattle Humane will spay pregnant animals. Pregnant spays are safe for the adult animal and provide a humane, painless death for fetuses. Please see these articles for more information. There are many things you can do to help our pets. You can join our animal care team as a volunteer. These volunteers help us reduce stress and learn more about our animals through enrichment activities, walks, and time with people. You can help us market our pets, especially the ones that are experiencing a long length of stay. Liking and sharing posts on social media, volunteering to take pictures or write cute descriptions, and marketing animals to your friends and family are all helpful in finding homes for our pets. Share your ideas with staff through the suggestion box. If Seattle Humane has identified an animal as at risk, you can help by researching potential suitable rescue groups, or helping to find a foster or adoptive home that meet the animal's specific criteria. We will now switch gears to talk about the impact of euthanasia on the humans in the shelter environment. Sheltering can be tough, even in organizations that have a very high live release rate. Some people experience compassion fatigue as a result of working or volunteering in the shelter environment. Compassion fatigue is a state commonly experienced by people helping others in distress. It causes an extreme state of tension and preoccupation with the suffering of others, and can create secondary traumatic stress for the helper. Self-care is always important, especially in this environment. We encourage you to set healthy boundaries, Think critically about what you are and aren't prepared to help with, and take breaks when needed. Symptoms of compassion fatigue include apathy, depression, isolation, anger, blaming, addiction, and self-harm. If you feel you are experiencing compassion fatigue, the most important thing you can do is take care of yourself. There are many different ways to accomplish this, and Seattle Humane encourages you to practice sustainable self-care. This can look different for different people, but some common practices include rest, meditation, exercise, and yoga. It may be necessary to opt out of the at-risk emails or to take a break from Seattle Humane. All Seattle Humane employees have access to our Employee Assistance Program. This program is confidential and conducted by a third party who will not share any information with Seattle Humane. Please contact Human Resources or your manager for more information about this program. You can visit healthycaregiving.com for more information on compassion fatigue. Thank you for listening and for caring deeply about the animals at Seattle Humane.